you to be in that position, your patients, my patients be in that position. That's where the immorality is. I'm a community clinic person. I didn't mean to, I may have misspoke, and I apologize if I did. It's the larger system that's a problem.
I have a problem with you saying that system.
Yes. Question.
Yes, a couple of things. First, to the community clinics, I agree wholeheartedly with the statement. I think you're doing more in some instances around chronic care management than some of the for-profits as it relates to community involvement. I think we need to talk about that. But the question I had was, since you ended on policy, and you talked about how big of an impact policy is having, how do you marry that concern with policy when you see that there are significant gaps that may require redistributive, targeted types of policy interventions that may not, in this kind of environment, get very far?
That's a really good question. I think part of the policies that affect public health, we have to consider our economic policies and educational policies. And it's well beyond the scope of my job to be discussing these things. But all of these factors do play into health. And unless we address the bigger inequities in our society, I don't think we're going to close these gaps. We've been talking about closing the gaps for, since I was in medical school 20 years ago.
Good afternoon, and thank you for your presentation. I noticed that this is the percentages that you provided are based on a survey, and they're subject to sampling error. What's the confidence interval at, say, 95% on some of the percentages we're looking at? If you can give us a rough sense of how close is too close to call.
We do have confidence intervals on all the data. Everything is very strictly analyzed. I'd say the greater limitations of the survey are that it's self-reported data and that there are sampling limitations. So the 2007 survey did not include people who have cell phones only. It was only people with landline telephones in 2007. So if they are homeless, they're not included. And if they had a cell phone only, like a young, generally people under 30, but also a lot of other people are using cell phones only, they weren't included. We're working to change that. California Community Survey has included cell phone users. I guess I need more specific. We have all the confidence intervals. The disparities that we're looking at in the report, you can see there are gray bars and black bars. That was done with statistical testing. So sometimes it looks like there's a disparity, and if you check the black and circle dots in the rainbow strip, you'll see, it looks like spot 2 is doing badly here, but it's not significantly different based on the analyses that were done. So I needed more specifics.
I'll ask it this way. Because it's public data and it's highly interesting, a number of us are going to attribute it in conversations we have with some of our constituents and colleagues. I simply would like to find out if it's possible, when the question comes up, to obtain the confidence intervals on a given statistic.
We can do whatever you need. We have it all in tables. It's too much to put in a book with the confidence intervals, but it's all organized so we can send those to you.
I just want to thank your office because I'm always calling them at the last minute. I'll call first, but I just want to thank you. They're really good about getting switching back.
Thank you very much.